Most people blame stress or age, but science proves these symptoms are caused by a vitamin D deficiency.
Tired all the time? You might have vitamin D deficiency. Science explained. Feeling exhausted or drained even after a full night's sleep could be more than just stress. Low vitamin D is scientifically linked to chronic fatigue. Vitamin D receptors are found throughout the body, and this hormone-like vitamin plays a key role in energy metabolism and neuromuscular performance. According to U.S. health research, vitamin D deficiency affects a significant portion of the population, with about 35% of adults in the United States being deficient. A 2019 study showed that older adults with deficient vitamin D levels reported significantly higher fatigue scores than those with normal levels. Another U.S. nutrition review also found a notable association between low serum 25-hydroxyvitamin D, the main blood marker of vitamin D status, and daytime sleepiness, low energy, and muscle tiredness. Mechanistically, vitamin D influences mitochondria, the power plants of cells, and supports calcium flux in muscles and nerves, both critical for energy production. Increasing vitamin D through sun exposure, diet, or medically supervised supplements has been shown to improve fatigue in deficient individuals.
2. Bone pain and back pain. Why your back pain won't go away. The vitamin D deficiency link doctors miss. Persistent bone or low back pain that doesn't match any injury could be a hidden sign of vitamin D deficiency. Vitamin D is essential for calcium absorption and bone mineralization. Without adequate levels, the body can't properly deposit calcium into bone tissue, leading to weakening and diffuse aches. In the US, research shows that millions are deficient, and researchers believe this contributes to widespread musculoskeletal complaints. Clinical reviews note that individuals with lower vitamin D levels often report deep bone and joint pain, particularly in the lower back, hips, pelvis, and legs. A 2018 umbrella review of multiple studies found that people with chronic body pain and arthritis conditions had significantly lower vitamin D levels than pain-free controls. Number 3. Muscle weakness and muscle pain. Weak muscles? This hidden vitamin deficiency could be the real cause. Muscle weakness, aches, or frequent cramps are classic yet often overlooked signs of vitamin D deficiency. Vitamin D receptors are present in muscle tissue, meaning this vitamin directly affects muscle strength and function. According to the National Institutes of Health, NIH USA, low vitamin D impairs muscle protein synthesis, leading to weakness and reduced physical performance. A large US-based study published in the American Journal of Clinical Nutrition found that adults with deficient vitamin D levels had significantly reduced muscle strength and higher fall risk, especially in older populations. Researchers noted that correcting vitamin D deficiency improved muscle power and balance. NIH researchers explained that vitamin D helps regulate calcium transport in muscle cells, which is essential for proper muscle contraction. The CDC also reports that vitamin D deficiency is linked to musculoskeletal pain syndromes commonly misdiagnosed as fibromyalgia. Without enough vitamin D, muscles fatigue faster and recover slower, causing chronic soreness and stiffness. Clinical trials in the US show that vitamin D supplementation improves muscle performance in deficient individuals within weeks, especially when levels are raised above 30 ng per ml. Frequent infections and weak immunity. Always sick? Doctors say vitamin D could be your immune shield. If you catch colds, flu, or infections more often than others, low vitamin D may be weakening your immune system. Vitamin D plays a critical role in activating immune cells like T cells and macrophages, which fight viruses and bacteria. According to the NIH and CDC, vitamin D deficiency is associated with increased susceptibility to respiratory infections. A major US-based meta-analysis published in BMJ showed that people with low vitamin D levels had a much higher risk of colds, flu, and respiratory tract infections. Supplementation significantly reduced infection risk, especially in individuals who were severely deficient. The National Institutes of Health explains that vitamin D helps regulate inflammatory responses, preventing immune overreaction while strengthening pathogen defense. This is why vitamin D gained attention during respiratory disease outbreaks in the US. Studies from American hospitals show patients with sufficient vitamin D levels recover faster from infections and experience fewer complications. Low levels, on the other hand, impair antibody production and immune signaling. 5. Depression and mood disorders. Feeling depressed? This vitamin deficiency may affect your brain. Vitamin D deficiency is strongly linked to depression, anxiety, and mood disorders, according to US medical research. Vitamin D receptors exist in brain regions that regulate mood and emotional behavior, including the hippocampus. The NIH confirms vitamin D plays a role in serotonin production, a key feel-good neurotransmitter.
A large study from the National Institute of Mental Health, USA, found that individuals with low vitamin D levels were significantly more likely to experience depressive symptoms. Another Harvard-affiliated study reported improved mood scores after vitamin D supplementation in deficient adults. Seasonal affective disorder, or SAD, common in the US during winter, is also linked to reduced sun exposure and falling vitamin D levels. Researchers explain that low vitamin D increases inflammatory markers, which are now known contributors to depression. While vitamin D is not a replacement for mental health treatment, correcting deficiency has been shown to enhance mood stability and emotional well-being, especially in mild to moderate depression. 6. Hair thinning and hair loss. Hair falling out? Scientists link this vitamin to hair growth. Hair thinning and excessive shedding can be warning signs of vitamin D deficiency. Vitamin D receptors are involved in the hair follicle growth cycle, particularly during the anagen growth phase. According to U.S. dermatology research, low vitamin D levels are associated with alopecia areata and diffuse hair loss. A study published by American dermatologists found that patients with hair loss disorders had significantly lower vitamin D levels compared to healthy controls. The NIH confirms vitamin D supports keratinocyte function, essential for healthy hair production. Without sufficient vitamin D, hair follicles may prematurely enter the resting phase, leading to thinning and shedding. This effect is stronger when combined with iron or B12 deficiencies common in the U.S. population. Correcting vitamin D deficiency has been shown to improve hair density and reduce shedding in clinical cases, though results depend on severity and duration.
7. Slow wound healing. Cuts healing slowly? Your body may be missing this vitamin. Vitamin D is essential for skin repair and wound healing. According to U.S. medical research, low vitamin D delays wound closure by impairing inflammation control and new tissue formation. The NIH explains that vitamin D activates genes involved in skin regeneration. Studies from American hospitals show patients with vitamin D deficiency experience slower recovery after surgery or injury. Vitamin D also supports antimicrobial defense in the skin, reducing infection risk during healing. Low levels reduce collagen formation and weaken immune response at wound sites. Supplementation in deficient patients has been shown to improve healing outcomes. 8. Bone loss and fractures. Breaking bones easily? Doctors warn about vitamin D deficiency. Chronic vitamin D deficiency leads to bone loss, osteoporosis, and fractures. According to the NIH and CDC, vitamin D is essential for maintaining bone density. Without it, calcium absorption drops dramatically. U.S. studies show deficient individuals have higher fracture risk even with minor falls. Supplementation significantly reduces fracture rates in older adults. 9. Excessive sweating. Sweating for no reason? Doctors say this is an early sign. Excessive sweating, especially of the scalp, is an early neurological sign of vitamin D deficiency. The NIH notes vitamin D affects autonomic nervous system regulation. Unexplained sweating may appear before severe deficiency. 10. Weight gain and difficulty losing weight. Diet not working? This vitamin controls fat storage. Vitamin D influences fat metabolism, insulin sensitivity, and hormone regulation. U.S. research links low vitamin D to higher body fat percentage and obesity risk. Correcting deficiency improves metabolic markers and supports weight loss efforts. If even one of these symptoms sounded familiar, get your vitamin D tested, because fixing it early can change everything. Like and subscribe to the channel for health content.